Good evening, everybody. It's great to have you all here with us. I've got here on my screen, my name is Jeff Ashby, and on the screen you can see the flyer for tonight, join Beth and Dr. Prasad, the harmful effects of electricity. Here we are on the 31st of August. An incredible evening ahead for us. We're going to take about an hour and go through some not just stories or journeys back to health, but this science behind it and how the microdaily products have really assisted Beth Sturdivant in doing this. Before we get too far down the road, though, I need to pull the disclaimer up on the screen because a lot of what you're going to be experiencing tonight, we need to make sure that we are legally protected. And so if you'll just follow along with me, I'm going to read this. It says, these statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational and entertainment purposes only. Engage Global does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage Global's products do, however, address our deficiencies and provide our bodies with the nutrition that we are lacking. So great to have everybody here. As we get underway this evening, we are recording tonight's meeting with Dr. Prasad and Beth. So I'd like to just kind of set the stage as we get underway tonight with this. You've already seen the flyer that we put together, but I ran across this. Is it possible to be allergic to electricity? And, there's a great little article put together. It says updated on June 1st, 2021. But we're going to be talking about some of those things this evening. Before I get into that, though, I want to introduce our guests. First off, I'm going to take Miss Beth Sturdivant, and this is a copy. This is the front cover of her book. It's entitled Backyard Secrets Exposed, My Journal, a Journal of My Healing Path Back to Life. Beth is our more than our guest tonight. We've got Dr. Prasad on as the guest, and Beth is going to be interviewing Dr. Prasad, and together they're going to help you all understand what a difference her journey has been. In fact, we're going to introduce you to I don't know if you can see just right under the 1 million bestseller. Beth's saga shows that an individual who is very sick can recover. I recommend this book. And Beth is going to explain who Dr. William J. Ray is because he plays a significant role as she was working her way back to health, and just absolutely incredible individual. So that is Beth Sturdivant here tonight. She can talk a little bit more about her book, and if you're wanting to get a copy of it, how that could take place. But before we go on, I would like to pull up here onto my screen a little bit about Dr. Prasad, and we're really fortunate to have Dr. Prasad here with us this evening. If you can look at that, this is a picture of Dr. Prasad, and this is the man behind Microdaily. Some of Dr. Prasad's exceptional works, accolades, and
that is nice.
And so I am just so happy to have you all here, and understanding that just some of his credentials: a professor of University of Colorado School of Medicine for 30 plus years as the director of vitamin and cancer research, former president of the International Society of Cancer and Nutrition. You think he knows a little bit about some of these things. A member of the British Royal Society of Medicine, invited member of the Nobel Prize nominating committee for candidates in medicine, and attended postdoctoral training at Brookhaven National Laboratory in Long Island, New York. And any of you know about Brookhaven and the research, what goes on there, it requires quite an incredible security clearance, and Dr. Prasad still holds that today. Under accolades, world's first radiation biologist, PhD, back in 1963, awarded 7 U.S. patents on micronutrients. He has several other patents that have been filed that are in a patent pending status right now. We may hear about some of those this evening. We could just go down through the list. Discovered the anti-cancer potency of vitamin E succinate, and those of you that have been following along with us, just 2 weeks ago, Dr. Prasad was able to take the research that he did back in the 80s, back in the 1980s, where he discovered that butyric acid, the small fatty acid formed by fermentation of fibers in the gut, is an anti-cancer agent. And we're just so happy to have Dr. Prasad formulating for us today on our the board with Engage Global, because we are now the benefactor of a prebiotic probiotic. We call that the prebiotic boost, that has the ability to help our bodies generate the butyric acid, because butyric acid cannot be supplemented in any way. It's Dr. Prasad's formulation and his understanding. And so definitely you're going to want to get back with the individual who invited you on tonight to ask more, not only about the Micro Daily, but this incredible new product that was just released. And while I'm talking about it, we have a special price going on that actually ends at midnight tonight, Mountain Time. If any of you wanted to add the probiotic to your subscription, you're going to enjoy the introductory price through the end of this year. And so it's a fantastic opportunity for you to add that and increase the gut health. So Dr. Prasad, here it says author and co-author over 29 books. You know what? He's way surpassed that. We need to update this booklet. In fact, his most recent one, I'm going to have Dr. Prasad talk about a little bit tonight. And it's also just become available on Amazon. In fact, our copy is going to be here on the 7th. So I only have to wait one more week until we get our copy of Dr. Prasad's brand new book. So excited to have everybody here. I think taking a few minutes and helping you understand the significance of the two individuals that are going to be talking to you tonight is worth the time that we put into this. So I'm gonna do this. Beth, I'll pull you up onto the screen here with me first, and we will also add Dr. Prasad. Beth, great to have you joining us from North Carolina. In fact, I've been exactly where you're sitting. I've been in your store. In fact, you actually enrolled with Engage Global right out in the parking lot of your store. And that was just a little over a year, maybe a year and a half ago, but pretty incredible. I mean, it's just the friendship that we have created over that time frame, and the number of people that you have physically and financially helped over that time has been incredible. So I've been looking forward to this evening. Beth, I'm going to just kind of step back out of the way and let you and Dr. Prasad visit here. But thank you for agreeing to come on. And you actually said, Jeff, can I do this with Dr. Prasad? And we've set it up. We put it here together. So, Beth, I'm going to turn it over to you.
All right. Thank you, Dr. Prasad, for
Hi, Beth.
agreeing to do this.
Great.
So I'm going to just start right away and read a couple things first. So would you agree that these are related symptoms of electromagnetic sensitivity or sickness? Chronic fatigue syndrome, fibromyalgia syndrome, Lyme's disease, chronic obstructive pulmonary disease. Would you agree that that is part of the electromagnetic problem?
Yeah, electromagnetic radiation can induce many acute effects like a hypersensitivity, mostly neurological. And the late effect could be cancer, could be neurological deficit, could be dementia, and tiredness, anxiety, depression. It has all kind of a problem. It can induce it. And many people are much more sensitive than the others, and it has become a kind of an environmental factor you can't get rid of everywhere it is. And therefore, the question is, if we know what it does and how it does it, then it is easy to devise some strategy to reduce the risk of electromagnetic radiation.
Yes. So below, I'm just gonna read a little bit to kind of like give a description of some things that go on when you are electromagnetic. So microwave and electric illness sufferers try to live a healthy life, finding no place to run or hide. Those who are suffering continue to struggle with not many answers. Fortunately for myself and the grace of God, I was able to go to 18 environmental doctors across this country and successfully be diagnosed by Dr. William Ray in Dallas, Texas. For people that don't know, Dr. William Ray was pretty much in the forefront of this, and he was one of the only doctors in the country in 2010 when I was diagnosed that could diagnose electromagnetic sickness because he had the credentials to do it. And it was done with a blind study. That's how he was able to do that for so many years. So in my opinion and experience, having suffered and I've helped many people each and every day, I realistically can state that most doctors are misdiagnosing radio wave and microwave illness. To be fair, doctors really do not know this problem exists. Below, I'm going to read many symptoms that pertain to EHS. Neurological, which, I don't know, Jeff, if you have that spot, maybe you can put that up, I don't know. But headaches, migraines, dizziness, nausea, difficulty concentrating, forgetfulness, short-term memory, memory loss, irritability, depression, anxiety, insomnia, sleeplessness, fatigue, weakness, tremors, muscle spasm, numbness, tingling, altered reflexes, muscle and joint pain, leg and foot pain, flu-like symptom, fever. More severe reactions can include seizures, paralysis, psychosis, and retching and stroke. And for me, I dealt with the retching part. I used to retch 100, 200 times a day. I mean, as soon as I was feeling something, I was retching. So under the cardiac part, it's the heart palpitations, the arrhythmias are off, the pain or pressures in the chest, low or high blood pressure, shortness of breath. The respiratory is sinusitis, bronchitis, pneumonia, asthma, COPD. Under dermatology, the skin rash, itching, burning, tingling, facial flushing, blood ruptures. For the eyes, pain or burning or dryness in the eyes, pressures in and behind the eyes, deteriorating vision, floaters, and cataracts. Auditorial is the chirping and the buzzing and the ringing in the ears, like tinnitus, hearing loss. And the others is digestive problems, abdominal pain, enlarged thyroid, testicular or ovarian pain, sexual dysfunction, dryness of lips, tongue, mouth, eyes, great thirst, dehydration, nosebleeds, internal bleeding, elevated blood sugar, immune system abnormalities, redistribution of metals within the body, hair loss, pain in the teeth, deteriorating feelings, impaired sense of smell, light sensitivity. And I know when I was really going through it, the pain in the teeth, it would feel like my teeth were going to come out. And I used to tell my daughter, my teeth are going to fall out because it just seemed like I was always getting pulled and I had those, the amalgam fillings in my teeth. And so until I got it out, it seemed like I was like a walking antenna to all the electromagnetic fields, and I was really feeling it in my teeth. So what do you think about all that I read to you?
Yeah, but I think that's amazing that some individual will have all those symptoms, but at least in many cases it has been documented, and some of them has been confirmed in the animal model. And here why these things are happening, what you described, many of the aspects of health. The electromagnetic radiation, like X-ray or gamma ray, also generate extensive amount of free radicals when you are exposed to. And that, of course, when you have oxidative damage in your cell, and if the cell cannot repair it, and then chronic inflammation sets in motion. So increased oxidative stress because of increased production of free radicals, more than your body can handle it, which causes the increased chronic inflammation level, and which releases a lot of toxic chemicals, pro-inflammatory cytokines, adhesion molecules, whole bunch of toxic chemicals that have a different effect on your biological system. The second thing is, which is not true, for ionizing radiations is that nature-made electromagnetic radiation, for example, ultraviolet radiation, is not considered polarized, and it is not considered. But man-made electromagnetic radiation, like Wi-Fi and all these things that we are exposed to, cell phone, they have a man-made electromagnetic radiation, and they are highly polarized. So what polarization does to your body? Well, what they have shown that this electromagnetic radiation, because of its nature that it is polarized, it vibrates the charged particles in your body, like sodium is charged, potassium is charged, calcium is charged, and some other organic molecule could be charged also if they have been damaged by free radicals. So once the molecule is charged, like for example, then they vibrates. So these kind of polarized radiation makes the charged particles in your body vibrates. And when they are vibrating, they become very sensitive to external damage by, say, free radicals or inflammatory cytokines. And so these are the two main uniqueness, actually one main uniqueness of electromagnetic radiation that is not shared by ionizing radiation. And so I think the one reason what you see this acute effect, and also don't forget heart or brain, they communicate with each other electrically. And when you have magnetic field around that area, then this electrical is get diverted. So the communication becomes abnormal. And that can create a lot of neurological issue, acute neurological issue. And so the question is what to do with that thing. So I think the symptoms you described has been described in the literature as well, not with one individual, but in some individual, it varies from one individual to another. Some have more hypersensitivity, some late effect is a dementia or loss of memory or neurological deficit, slowly becomes fully demented. And so, and also with respect to it is also a powerful cancer agent, a cancer-causing agent. And again, as you know, in the cancer also, increased oxidative stress and inflammation are involved in the long process of converting normal cell to cancer cell. And so in human, epidemiologically, a study showed that, yes, it increases the risk of brain cancer. And in some cases, at least in one woman, when she was keeping a cell phone near her breast, and they develop a breast cancer. And so epidemiological study is not a cause and effect, it is association. But when it gets confirmed in the animal model, then you think it is reality. And so huge study was in a National Toxicological Center in North Carolina, I think they've confirmed that in animal model, the electromagnetic radiation, much lower than 5G, can increase the risk of cancer. And so and also it affects the reproductive system, both ovary and testes. And so as a late effect, it is a lot of problem. And actually this observation was made as early as 1970 when Soviet Union was there, and their people were working with all the military equipment, which has a high level of electromagnetic radiation. And they found that they have a hypersensitive syndrome that some of them you are describing. And so it is a real phenomena. Doctor is not aware of. Many people are not aware of it because they don't explain it. And as you know, that initially they thought that first it was detected in Cuba, that some of our troops or personnel got a unexplained syndrome and that depression and anxiety and like some of the symptoms of balancing problem, dizziness, like you described. And so they thought that the Cubans are creating a problem, using a high-power weapons to create a problem for us. But then they started detecting in many other countries our personnel is suffering from those kind of a syndrome. So United States government appointed a high-level scientific community to discuss what is going on here, and about a year ago, and their conclusion was that they rule out many other factors, that it is related to electromagnetic radiation, and so this is a fact. But now the question is, that not many people believe it, and until people suffer it, they don't, physically. But see, acute problem, not too many people observe the acute problem like you are observing it, but many people do. And Dr. Court is one of the best fellow who has experience himself, and he treats patient, as Beth, and he is one of the expert in this area. And so I think, knowing that, I felt that at least we can devise some strategy which can protect against electromagnetic radiations, and trying to make the body more neutral, less charged, and therefore they can sustain. And so that's why we developed micro daily EMF. And I don't know, I presume you are taking it, but the Dr. Court uses all the time to his patient who shows hypersensitivity. And but see, they are not, just like, it reminds me like tobacco. In early 60s, I was here as a student when people started saying that it might cause a cancer, tobacco. And tobacco scientists said, no, this is not a carcinogen, this is not addictive. And then, of course, as you know, a few years later, turned out they were wrong. And so right now, denial by the industry or by fellow industry scientists that electromagnetic radiation is totally safe is incorrect. And some of the late effect of this thing takes 10, 15, 20 years, just like ionizing radiation. If you are exposed to ionizing radiation today, it might take 10 to 30 years to develop cancer. And so not only cancer, but also, as I said, that reproductive health, and also more important is not only the cancer, but most important is in various kind of neurological diseases, including neurological cancer.
Well, there's a lot involved in depth with electromagnetic, and yes, Dr. Court is great that he actually knows what it feels like. So that's why he's totally better at it than these doctors that have not experienced the pain from it. So, did you know Dr. Ray, William Ray in Texas?
No, I don't know him personally. No.
Okay. Yeah.
No, you can tell me about him. I don't know.
Well, he was the one that had the clinic in Dallas, and he helped people all over the world. And now he's passed. He passed a few years ago. But he was in the forefront. And actually, he did one of his statements on the International Journal of Molecular Science. He stated EHS is a neurological, pathological disorder which can be diagnosed, treated, and prevented. He is becoming a new insidious worldwide plague involving millions of people. They asked, World Health Organization to include EHS as a neurological disorder in the International Classification of Disease. So Dr. Ray said the term electromagnetic hypersensitivity was first proposed in 1991 by him to identify the clinical conditions of patients reporting health effects while being exposed to an electromagnetic field. This term was then used in 1997 in a report provided by a European group of experts for the European Commission to clinically describe this unusual pathology, which may imply EMF exposure. So my first question to you is, Dr. Prasad, can you explain what is the breakdown in the body when you start to have the electromagnetic sensitivities? What's kind of like, the science breakdown?
Yeah, I mentioned that, the electricity can be shielded a little bit, but electromagnetic, you can't shield it, but it penetrates in your body. And as I said, because of the magnetic field, first, all the organs which rely on an electrical communications like brain and heart, they will have an impact because magnetic field distort the function or electrical communication between the cells. And so that's one of the major problem is there. And as I mentioned it, that when it enters your body and your body has many charged particles, they start vibrating in the presence of electromagnetic radiation. And when the molecule vibrates like that, they become much more sensitive to any toxic agents, including free radical or inflammation. And that's why you see all these acute effect. And then, of course, late effect is because of the increased damage by free radical and inflammation. You see the late effect on brain or heart or anything. But acute effect is mostly related to the characteristic of magnetic disturbing the electrical communication and vibration of the molecule and generation of extensive amount of free radical and inflammation.
So would that have to do with the potassium and sodium in the body?
Yeah. Any particle which is charged.
Yeah. So
and that affects because those are very important functions. Those are charged molecules for your vital organic molecules. So if they get disturbed, and then your body function becomes abnormal.
So basically, when you get to an acute situation, that's the breakdown of the body doesn't have what it needs to support itself.
Yes.
Neutralize.
Yeah.
And that has a lot to do with the minerals in your body, correct? And
yeah.
The vitamins and that.
And so what micro daily or antioxidant comes in, they prevent those kind of first they prevent free radical generations, and if it is a charged particle, they might donate electron to become neutral, so that at least they get partly protected. As a transient phenomena, this could happen. We don't know for sure, but and because it looks like, at least in the Dr. Coat experience, that it has been very useful, micro daily and EMFs or brain boost, and many aspects of antioxidant or micronutrient. We don't know why it's producing such kind of results. Some of them we can explain it, other we can't, because we don't know many function of the micronutrient.
So what causes the extreme swelling? Like for me, when I was around electricity, or even like if you fly in an airplane, you'll see that a lot of people's eyelids and that start swelling. And I know that's one of my symptoms when I'm around a lot. Right now I'm around a lot, so
yeah.
You'll see it. So what causes that swelling in the body?
I think, some people are, I think, air sickness, they throw up and I don't know. Some people take a Dramamine, prescription drug, to calm them down. And so it must be the hypersensitivity of the brain. And brain, as you know, brain and gut axis is there. And so this might create a nauseatic problem. I don't know for sure. But I know not many people, but some people do suffer air sickness. Some people suffer ocean sickness. So it is all related to neurological and gut axis relationship, and they get disturbed for whatever reasons. And then some people are more sensitive than the other. It is happening to other people as well, but they don't express it.
Right. So you would say that your new probiotic would definitely help somebody that has an EMF problem.
I think so. Probiotic will just stabilize it. We don't know about when you travel on the airplane, whether it will help or not, because nobody has done the experiment for that. But at least probiotics and good diet together will help your intestinal gut in a good health, and therefore your brain function will improve, therefore your heart function, and prevent any abnormality both in heart. Because nowadays they have discovered also, like brain and gut axis, there is also gut and lung axis as well. So they communicate with each other. So maintaining, and one way to maintain gut health is not only good diet, which is very important, but also good probiotics, breathe prebiotics, very important.
So do you feel like you have to be exposed to a chemical first to have an electrical sensitivity? Like they sprayed Sahara under the power lines where I live.
Yes.
What triggered it?
Yeah, I mean, chemical sensitivity is very similar to certain chemicals can create, like, can if you take it orally, but you are exposed to and your body absorbs it, and it's just like a electromagnetic radiation, they will get in your system and cause some damage in terms of by producing free radicals and inflammation. But
So,
again, some people are very sensitive to certain kind of chemicals, not all chemicals, certain kind of chemicals.
well, I believe with the Sahara, it just dumped a lot of heavy metals, which caused more
Yeah,
issues
of course.
in my body.
Yeah. How you got
So,
so much heavy metals?
yeah, I was medically diagnosed with brain damage. My nervous system was damaged, endocrine system, heavy metal poisoning, and extreme edema.
But how you got exposed to? How you got exposed to heavy metal?
Because of the chemical Sahara that they sprayed is sister to Agent Orange.
And, I see.
I got the drift when I was working and sweaty in my yard.
Okay.
And they were spraying on the power line. I didn't know. So it's just, I guess it was meant to happen for me to go through this journey so I could be on here today with you.
Yeah. No, I mean, heavy metal, as you know, that once you get in your body, it is difficult to eliminate them through like we do normally. And so they stay in your body. But only one thing you can do to protect yourself if you know you have been exposed to is that they block their toxic effect. And heavy metal also it cause damage to the cell, and damaged cell will start producing a lot of chronic inflammation. And chronic inflammation release a lot of toxic chemicals. So if you can block all those things, heavy metal can be there, but they are not causing any damage because they are producing those chemicals, but we are protecting the cell from those chemicals. You see what I mean?
So you would say using the microdaily EMF.
Yeah, right.
Help that a lot to protect from the chemicals.
That's right, because anything you get to your lung, whether it is a small particles, you can get rid of. These are solid material, and all in your brain heavy metals, and that's why we don't in our product we don't have heavy metal like zirconium, vanadium, and so on. And so I think anytime you do, we can control them because they can't be eliminated once they get in your body, but they produce toxic chemicals. And if we can protect those toxic chemicals, then we maintain reducing their potential adverse effect. And that's what we have done with microdaily EMF.
So obviously the mercury fillings didn't help either, because I know my teeth were being pulled to the electromagnetic fields. I could feel like when we would go down the street, I would swell really, really bad in a vehicle, but it was feeling like pains were going through my mouth, or like when I was at my parents' house and the refrigerator would go on and off, it would feel like a missile going through my head. And so that was the chemical reaction with the heavy metals and everything in the brain. Is that what's...
Yeah, so you must have a lot of charged particles in your body. I'm sorry, but that's very unusual case, your super sensitivity. And so if you have been exposed to a lot of metals, heavy metals, and also with probably other charged particles as well, and therefore it is tough to tolerate electromagnetic radiation, which can interfere with function of your organ.
And before I got to that point, couple years before, when I would go into the mall or whatever, and I had Subway restaurants, so I literally would break and shut down computers. Everybody had trouble with their computer when I was around. Yeah. I erased the whole programming system for my Subway computer. I mean, it was crazy. I was breaking all the computers around the house, and everywhere I went, somebody was saying, we're having trouble with our register now. And I knew it was me. But that's because I was so charged, I was interfering with their computers.
Yeah.
That's crazy. So a lot of people that have electromagnetic sensitivity have the same symptoms as like somebody has concussion.
Yeah, yeah.
The sensitive with, you can't deal with light. I couldn't deal with any light, not even a crack of light. I couldn't even deal with a candle flickering. That's how sensitive.
Yeah, that's why Dr. Court suggests that some of his patients, if they don't take micro daily before coming, they start experiencing these kind of some of the symptom, acute hypersensitivity that you are describing, Beth. And so he makes sure that before he enters it, he has a micro daily EMF, and then they don't express. I don't know whether it is your experience or not.
Oh, yeah. So one thing that happened to me was I had sticky stuff leaking out of my brain. It was literally coming out of the hair follicles. I have it on video. So was that the amyloid plaque that gets built up from overheating the tissues with the cell phones and that year after year? What's that leaky stuff in it?
I think again, leaky gut reflects your intestine is in a very poor health, and when that happens, that means the ratio of it is always a good and harmful bacteria is always there in your gut, but when that happens because of the poor diet or because of the exposure to toxic chemicals or whatever, then this ratio changes. So now there are more toxic chemicals which generates a lot of inflammatory products, and that causes damage to the intestine, and then send the message to the brain that it is, and so that's why your gut becomes not happy, and then you go to diarrhea or feel like having one, and so that is a serious problem, and so we are. But in a clinical study, it has been shown that some of these, at least two strain of bacteria, one is the bacterian origin, and another is yeast origin, Bacillus coagulant and Saccharomyces boulardii. These two strains are acid resistant and heat resistant, and they have been shown clinically to markedly improve the symptoms of any kind of inflammatory disease, including the leaky gut or Crohn's disease, or irritable bowel syndrome, and so on. And so I'm hoping that we not only have a very good bacteria, that our gut has like Bifido strains and Bacillus strain, but these two will survive because those good bacteria strain that we have, they don't survive if we take orally. In acid pH 80 to 90% get destroyed. And by the time they go through the bile acid and other things, very few of them can survive to form colony in your lower intestine. And so that's the reason we feel that our probiotic with prebiotic is extremely important, so that they can generate more butyric acid, as Jeff was mentioning, and they generate also many neurotransmitters that is very important for brain functions. And they produce and when you take the diet, they can better absorb. And so it has a lot of good function. But I want to emphasize that if you take a high fat diet, if you take a lot of sugar, that hurts intestinal flora. In other words, then the diversity or the ratio of the good or bad bacteria changes. And then when they changes, then you have all kind of gut problem. And so in order to prevent that, you also control your diet. And I mean, sugar is very important for your brain function, but not excess sugar, what I mean, or excess fat. Certain amount of fat you need it. But I'm talking about the excess fat or excess sugar. And so if you do that, I think then the leaky gut issue would be improved. That's what clinical data shows, but at least they use separately. Bacillus coagulant. Bacillus coagulant is the only FDA-approved probiotic that FDA required to add in an infant formula, because infant, when they are born, their stomach is sterile. So there's a risk of a bad bacteria taking over. And so when they put the coagulant, and then they prevent the entry of any bad bacteria so that kids can grow healthy. And so we have added that, and also we have added a Saccharomyces boulardii. They are of yeast origin, and they don't stay in your gut for a long time. They stay for 4 or 5 days and they get eliminated. And so I think the probiotic that we have developed with prebiotic is going to be very useful in maintaining good health, in improving any kind of inflammatory bowel syndromes. And leaky gut is one of them.
So the collagen, obviously, can you tell us why it's so important supporting the body with people that have electromagnetic?
Yeah, but, as you know, collagen represents 30% of the total protein that our body has. 30%. So it is present in every organ, every brain. And the main function of these to maintain the structure almost mechanical in place. That's the function. And of course, in a joint and in every place, in bones, it is very important. And so as you grow older, then collagen start getting lost. And why? Because the enzymes which degrades them, their activity increases. Why? Because as you grow older, you have a more oxidative stress and inflammation. And the more you have, then the enzyme which degrades or destroys collagen gets elevated. And so you start gradually losing collagen from every place. And so the question is, skin gets wrinkled, sagging. So visibly you can see you are growing old. But inside the organ, they are also getting old. And because of it, they are also losing. So you have more joint pain and cartilage problem and so on. And so we decided that in a commercial market, the collagen peptides, because you can't take collagen as a whole protein because this can create an allergy because if they're from different source, because it's a protein. So they get converted to what is called peptides, so small fragments, and they get converted very easily in the intestine in amino acid, and then they get absorbed and body makes a collagen. And so we decided that the commercial market that they're being sold, they require a large amount of collagen, and the effect does not last long because you are not addressing the main issue why collagen and elastin or hyaluronic acid is decreasing. You have to address that. So we address that by putting a inhibitor of those enzymes so they get inhibited. And so when the new collagens are formed, they stay for a longer time in our body and can reduce, and many clinical studies have shown that your joint pain when you walk and becomes healthy. And even in experimental system, it has been shown that collagen peptides, which is collagen 6 in the brain, they can bind with the beta amyloid, which is considered responsible for causing Alzheimer's disease. And so again, this is very important function there. But most of the things like people have started losing bone minerals, and in case of women, they develop osteoporosis. And if you have a collagen peptides, they can prevent the loss of the minerals. And so your bone remains strong. And so collagen have a lot of important function in the body. And therefore, I think, say, collagen peptide with enzyme inhibitor that we have is going to good. Not only your outward appearance looks good, but in terms of reducing the wrinkling, hydrations of the skin and so on, but also that inside you will feel better.
So one thing, this is not really a question, but my experience of being in an airport and in an airplane, I used to fly to California because my kids live there. It would feel like I had 1,000 needles, poking me at a time. I feel nauseated, blurry vision. Center of my forehead would ache. I would swell. Everything would get tight on my body. So this past June and July, I was able to fly. And it's because of the microdaily. I didn't feel anything at the airport. I didn't feel anything in the airplane. So I mean, that really is a miracle for me because of all what I went through. So it's amazing that this product really, really does work against, blocking all those symptoms that I had before. So I've taken a lot of product though. Lots.
Yeah.
So my big thing is what healing steps have taken place in the body and brain with Micro Daily for me to achieve that outcome? So what's happening in the body since I've been taking it that's allowing me to be able to deal with the electromagnetic?
Well, I'm glad to hear that you are doing well on Micro Daily.
Mm-hmm. So what's taking place in the body since I've been taking your product? What's taking place that I'm being able to be so much better today than I was 18 months ago?
Yeah. Mandy, for example, in a brain, I presume you take do you take a brain boost?
I take everything.
Yeah. So you can see that in case of brain has a much higher level of antioxidant protection than nature provided it. And as you know, that a brain is the most is one of the organs who are exposed daily with the highest number of free radicals, because during use of oxygen, they generate a lot of free radicals. And but brain has normally lowest level of antioxidants, but providing additional antioxidant to the brain, we are protecting against further damage. And another thing is that for example, in a brain boost, we have added not only, for example, curcumin and resveratrol, which has a very high, more powerful antioxidant and anti-inflammation than other vitamins, work by different pathways. But also that we have added two additional, for example, coenzyme Q10, which is required by the mitochondria to generate energy. And we have also added a vitamin B3, nicotinamide, and they are also require mitochondria to generate energy. So we have given a substrate for mitochondria to generate more energy, can better protect it against oxidative stress and inflammation. In addition to that, brain has a lot of membranes, and when they get damaged and membranes are most sensitive to free radical damage, and so there are damage occurring all the time. So we provided two precursor of membrane which are used in the brain. One is called phosphatidylserine, and one is phosphatidylcholine. And so when the new membranes are formed, because we have provided extra amount of precursor, and now we are already protected by giving a high antioxidant, so you can brain operate for a nice and normal function. And this is true throughout your body. Not only that, your immune system is better protected, so you get a less infection from any kind, whether it's a bacterial or viral. And so it has not only important for the brain, but in our body we have a immune function improvement, and also at least one study we showed clinically in collaboration with Dr. in Denver, Jeffrey Boons, who is a cardiologist of Bronco, that Micro Daily can also improve the lipid profile as good as Lipitor. And so it is affecting all your major organ in your body. And by taking a Micro Daily, your joints and bones and everything, your physical appearance, I don't know if I'm looking younger now at the age of 87. But I'm trying for the last 2 weeks now, Sometimes I feel that I'm better looking than sometimes I say, well, I don't know.
Okay, I got one last question, and it's kind of off subject of EMF. And this is just because there's, a lot of people on the call. How does Micro Daily support the body in healing from COVID? I mean, it's still a big subject out here.
Yeah, I think the main reason healing really is body healing. The main culprit which causes damage to your system, whether it is by free radicals, which is heavy metal or anything, they produce a lot of free radicals and inflammation. And that causes then later on all kind of damage in your cell DNA. It can cause a damage to your organ system and so on. But these are the two main things. And if you could control these two things in the beginning, you can have a better aging process. You can have a better health all through your life. But sometimes even in the middle of it, like I have been taking this kind of nutrition that I prepared for a long, long time. And so I think, earlier when you start, the better it is, but it is never too late. You can always do that, because as you grow older, this is a fact that you have increased oxidative stress because of excessive production of free radicals that your own body antioxidant cannot handle. And therefore you need a substitute, extra micronutrient that we have in a micro daily. And so these are the things that your body is enjoying and taking care of. All extra free radicals. Certain amount of free radicals is very important, but these antioxidants cannot reduce 100%. But as long as it reduces 75%, we are happy.
Well, I want to thank you for being on the call tonight. Jeff is going to show a quick video, and then we'll come back.
Jeff, yeah. Also, I just wanted to communicate with you that Jeff was mentioning that I have written a book on a dementia for consumers and memory loss and how to prevent and treat. You can see this book is available in Amazon.com. I think you may enjoy reading it and to see what we're learning about it, why it happens, and what you can do to prevent it, and how better can be treated.
Well, I've ordered 2, and I've encouraged my whole team to order. So,
thank you. Okay, well, Jeff, go ahead.
No, pretty amazing tonight, where we've gone full circle from not just the microdaily EMF, and you talking about the Havana syndrome and electromagnetic hypersensitivity, and for Beth to be on here and talk about her groundbreaking work with
that's amazing. That's amazing.
And then we tie it all in with the probiotic and the collagen and brain boost. I mean, we've talked about a lot of our product line here tonight.
They're all linked. They're all linked.
Yeah, and that's exactly what I appreciate about you, Dr. Prasad, is that you're when you create something, there is a reason for it, and it ties synergistically to so many of the other products. Yeah. And so it's just phenomenal. Well, you were talking about Dr. Court earlier, and I was able to go out and grab an interview that Dr. Court did with one of his patients. I don't know if you remember Ryan Dickinson.
Yes. Right, yeah.
And so I've been able to pull up that video.
That's really good.
Let me just share that as kind of a culmination, and we put a bow on the end, on the top of this presentation tonight. Sure. It's only about 5 minutes long, so stick around.
That's okay.
We'll come back, but I'm gonna have both of you kind of step off the spotlight here for a moment while I share Ryan Dickinson's experience, and he's right, as Beth was talking about. Electricity. He worked at a power plant, and so let me just share Ryan with everyone.
For about 12 years, I was an electrician, and the last 10 of those years was in a big industrial plant. And I've been working there for about 10 years. And in 2016. I was sitting in my car doing some stuff on my phone, about ready to get into work. And I had this big kind of whoosh feeling where I felt like I was totally dizzy, felt like I was going to faint. I tried driving. I couldn't do it. I called my wife. She was about 20 minutes out, and I said, I can't do that. So I called an ambulance. I called 911. And for 3 years after that, we tried to figure out what the heck was going on with me. We probably went to 8 different doctors, physical therapy. And so the symptoms I had was, there was a whole bunch, so I made a list. Dizzy was a big one. The nauseous was a big one. Fainting feeling was a big one.
Ringing in the ears.
I had ringing in my ears.
Couldn't sleep.
Couldn't sleep. I had very low energy. I just couldn't do anything for very long.
Concentration.
I couldn't think straight. I couldn't concentrate. My memory was actually starting to fade. I couldn't remember things as well as I could. I was very irritable. I was short fuse, unfortunately. And that's totally not me if you knew me. Let's see here.
Depressed, anxious.
Oh, well, yeah. I was depressed and very anxious. Like Beth, I felt like I couldn't go anywhere. The bright lights was too much for me. Loud noises was too much for me.
He missed birthdays.
And then, of course, we have kids that were like 6 or 7, 8, 9, something like that. Young kids.
Yeah.
So I couldn't be around them. I missed their birthday parties. I missed family events. It was hard for me to walk out to the mailbox and back. And then, is that all? Yeah, that's pretty much all the symptoms. But
that's enough, right?
Yeah, I had a few. But then we found Dr. Court, and he told me that I had EMF hypersensitivity, and all EMF was exposing me, and from him, and then he had me take microdaily right from the start, and it changed my life. Yeah, I mean, I'm able to do things now with the family. I'm able to go on trips. I still get exposed and feel a little bit of it, but I mean, with the microdaily, I just take a little extra dose, and I'm right back on my feet again.
Yeah, he's been feeling a little bit, so he just put some.
Well, I'm also doing a metal detox right now too, so that's part of it also. But I mean, people ask me, would you ever go off of this? And I mean, no. I mean, this has saved my life. So why would I do that? And then, of course, now we're health advocates, and we want to give this gift to everyone else and help everybody else, because it's Dr. Prasad, you're one of the best human beings in the world.
Thank you.
Thank you.
Thank you, Brian.
Great job, Ryan.
Great
job. Woof, man, I get all emotional, a little misty-eyed.
Well, that's what this day's for.
Can we talk about symptoms?
That's amazing. That's amazing.
Dr. Prasad, let's talk about symptoms real quick. For people on this call, they may not know what EMF hypersensitivity is. Beth has so many symptoms, and Ryan, we need to explain to people out there. They come in and they're treated like they might have mental health. And this is a real, Dr. Prasad and I just read a paper from NIH that they actually really are looking at certain parts of the brain that are affected. This is not psychosomatic. They have tinnitus, ringing in the ears. They have brain fog. They have insomnia. They have pain when they get near any technology. They have severe balance issues. They can't sleep. I mean, it is really debilitating. But you know what's so exciting is that before microdaily EMF, we didn't have a lot of strategies for people. And now we know that it's safe, and this is really changing people's lives. And I hope the people on the call tonight have a lot more awareness for what EMF hypersensitivity is. We're seeing a lot in our children because we're doing a lot of research, and we're getting to see a lot of this type of behavior like irritability, impulsiveness, agitation. And just know that the children's formula could make a really big impact on their life by getting these nutrients in.
I'll just cut it off there. It was an incredible interview, and like you saw, Dr. Prasad, you were part of that interview as well, talking about these things. In fact, Beth was on that call as well that night. So, I think this has just been an incredible evening. I can't tell you how fast this last hour went. And here we are. While I'm still on full screen for everybody, I want to pull up Dr. Prasad's book. Let me grab it right here so that everybody can see it on your screen. Dementia, and then in parentheses, it's memory loss. Paperback. You can see that he just went up on Amazon August 18th. I said we've ordered our copy, and we've tried to acquire as many of Dr. Prasad's books as we can get our hands on, just because just because he's so available to us, it's our way of going out and sharing with people that it's what he has done in his lifetime is absolutely amazing. The other thing that I'm going to do is, and Beth has it there in the chat as well. Her book, Backyard Secret Exposed, is also available on Amazon if you want to read into the rest of her journey. So pretty amazing this evening as we have come together and been well educated. Beth, thank you for putting together the time, getting the questions. Dr. Prasad, amazing. I'm going to pull both of you back up here onto the screen with me. What an incredible evening and a fantastic way to close out this evening. As I mentioned earlier, as we were kind of talking about things tonight, is the last night that people can add the probiotic boost to their subscription. And we're seeing just during this call several more subscriptions have been changed and added. It's been an incredible month. We don't really have time now to open it up to questions and answers, but I want to invite everybody that is on tonight's call to get back with the person who invited you on and look to their leadership. They can make the right connections that any of you need with Dr. Prasad, with Beth, with myself. Get your questions answered. That's what these are all about. Is we have these every Wednesday night. In fact, to those of you that are looking at your calendar, 1 week from tonight, we are going to be back here. It's going to be the first Wednesday of September.
Yeah.
I mean, where's the summer gone? But the first Wednesday in September is going to be an Ask Dr. Prasad evening. And so not to make any of you wait, but if you wanted to, 1 week from tonight, you can come back and we can continue this conversation. We can visit about this and other things. Really, it's an open evening for you to ask Dr. Prasad. And then we're going to have other things. Wednesday is always a fantastic night to come and be with us. Also, Sundays is a great evening to get together. We also have lunch and learns every weekday at 12 p.m. Eastern time. There's a lot of things going on. We have micro daily conversations on Tuesdays and Thursday nights. So there's a lot of places that you can come and just become educated about the micro daily products. So anything else as we're closing up, Dr. Prasad, Beth, that wasn't covered or you'd like to say before we say goodnight?
No, I think Beth, go ahead.
I was going to say we have that Monday call on Monday night also too. People want to get on there and ask questions, they can.
Yes. Beth has a call on Monday night. We can get that information out to you. It's on the Team MMF Zoom line. I'll let you. I'll just get back with the individual who invited you on. And so Monday night at it's 4, 5, and 7. Yeah, so 7 o'clock Eastern time. Awesome. Thank you, Beth, for recommending that. And then Dr. Prasad, last words from you.
No, well, just again, thanks, Beth, for inviting me, and thank all of you participating in this discussion. And the one way you can maintain all your health is to have a good diet, take exercise, and take micronutrient that you need for your eye, for your brain, for your whole body, for your gut. We all have it, and keep looking young and enjoy life.
You're a good example.
Exactly. I was just going to say, Dr. Prasad is only 3 months away from being
88.
88. That's old. Yeah. So Dr. Court put together the dates, and we realized that Dr. Prasad and Elvis Presley were born on the same
day.
The exact same day. Dr. Prasad over in India, and Elvis Presley here in the United States, and so yes, every
he became musicians, and I became a nutritionist, micronutrient.
Both the top in their fields. So thank you, everybody.